Hello, I'm Dr. John Tolmosoff. I'm here with Dr. George Chapman. Dr. Chapman is one of the pioneers who have developed systems of how to look at the musculoskeletal system. And George, today we have a picture, and why don't you explain to us a little bit about what you've seen of a patient of yours?
All right, this is a patient from 1988. She appears to have had a stroke, and with the stroke she'd have to walk with one of the little carts with the wheel on the front, and she'd be pushing the cart in front of her, and that would protect her balance so she didn't fall over and hurt herself. But as she used the cart, she then also developed some other peripheral type changes in the forearm and in the actual body itself. In the forearm right here, this is the left forearm, we can see a well-defined area of cold or hypothermia, and that cold then is an increased nerve function due to abnormal activity, and that's a neuropathy.
And you can see that pretty clearly right there. And now we have the opposite side there, Dr. Chapman, and we're comparing the last picture to this one here, and we see this one's kind of lit up more on the opposite side.
Right, she's developing a lateral epicondylitis or tennis elbow, and that's characterized by increased heat. Right at the arrow, we see the little area of increased heat. We also see in general increased heat along the side of the body, and that's due to compensation kinetics or altered weight bearing on the right side. So as she pushes the cart, she has neuropathy on the left, and that's cold. She has increased heat on the right hand side, and that's due to tennis elbow.
Now, what would she have been noticing? What were some of her complaints when she came to you?
On that particular issue, as she would use the cart, she was developing a lot of pain in the elbow area, and she has numbness going along the forearms and inability to grip.
And now we're going to look at the next picture, and this really caused a major problem on the left hand here.
Right. She's actually developing a condition called reflex sympathetic dystrophy or complex pain syndrome involving the left hand. Right in this area here, the entire hand is hot, and that's due to a loss of postganglionic fiber function. As the postganglionic fibers no longer connect up with the blood vessels, everything dilates, everything gets hot, and she now has lost function in that side. That's an irreversible sign. Had she had the thermogram done earlier, we would have been able to do specific exercises and rehabilitation and regain that function. But once it gets hot, it's irreversible, and at that point in time, it's nothing we can do.
On our next series of talks, what we're going to be doing is seeing how we could use thermography in the musculoskeletal system to actually monitor the changes and the effectiveness of treatment. Thank you.